Hello friends, welcome to this new video of solved pharmacy MCQs. This is actually the 16th part of the series that we will call solved pharmacy MCQs. So please be with me for the whole duration of this video because we are going to discuss here a new set of 10 MCQs that are going to be related to pharmacy professional subjects like pharmacology, microbiology, and etc. etc. So friends, big welcome to this video. Now we will be beginning to discuss these MCQs. So today our first MCQ of this video is people with which blood group are said to be universal recipients, meaning they can receive blood from everyone. Actually, in this MCQ we are asked to identify the blood group that can be called as universal recipient, meaning that a person with that blood group can receive a blood donation from anyone, because for this reason he is called a universal recipient blood group subject. So options are given: A positive, B negative, AB positive, O positive, and O negative. So we have this knowledge on blood group types. If we can also search it on Google Images. Those images may describe for you the blood groups and their respective donors or recipients. So this is related to a blood group type question. Yes, so the universal recipient here is AB positive. Actually, this is the blood group that is called as universal recipient. Now the second MCQ: a person with blood group AB positive can give blood for transfusion purposes to people with blood group of. Actually, in this MCQ the receptivity of AB positive blood group is asked about. That if a person has AB positive group, then to which people to which blood groups that AB positive blood can be transfused with. So a person with blood group AB positive, actually AB positive, as we have learned in the previous MCQ, that it is a universal recipient, meaning it can get blood of any type from anyone. It is a universal recipient, but whom this blood group type can serve as a blood donor. So AB positive can give blood for transfusion purposes to people with blood group of AB positive only. AB positive can receive blood from anyone, but it can give only to AB positive. So this is situation here. Yes. Now the third MCQ: there is a patient in the emergency department who is in dire need of blood transfusion. His blood group is O negative. People with what blood group can give this patient the required blood? Actually, O negative is a universal donor, meaning that it can donate blood to anyone. But here the question is asked about its being recipient, that O negative blood types can receive blood from which blood type people. So options are given here: O negative only, O positive can be given any blood group, AB positive can be given, AB negative can be given. Actually, O negative is a universal donor group, but it can receive only from O negative. So this can be said, or perhaps nothing can be said about it, but this seems like, at least logically, a bit of injustice, that O negative can give blood to anyone, but it can receive only from O negative. And on the other hand, the AB positive blood group is a universal recipient, meaning that it can take blood in emergency situation like transfusion, but its blood is useful only to the AB positive. So AB positive can give only to AB positive, but it can receive from any blood group. And also on the other hand, O negative is a universal donor, meaning it can give blood to anyone with any blood group type, but it can only receive from O negative. So in short, AB positive can give blood only to AB positive, and O negative can receive blood from only O negative type. So these are the blood group type systems. Yes. Now the fourth MCQ, sirolimus, an immunosuppressant drug, is classified based on its mechanism of action. So options are here: calcineurin inhibitor, co-stimulation blocker, mTOR inhibitor, microtubule inhibitor, tyrosine kinase inhibitor. Actually, in this MCQ we are asked about the mechanism of action of the immunosuppressant drug called sirolimus. So it is actually mTOR inhibitor. mTOR stands for mammalian or mechanistic target of rapamycin. Actually, rapamycin is another name for sirolimus, and these immunosuppressant drugs will inhibit mTOR. This is actually the target for the immunosuppressant drug sirolimus, also known as rapamycin. Now the fifth MCQ, all of the following classes of drugs are used in chemotherapy of varieties of cancer except one. Actually, these pharmacological classes are used in the chemotherapy of cancer, varieties of cancer. So we have to identify those classes of drugs that are anti-cancerous. So pyrimidine antagonists are anti-cancerous, anthracyclines, nitrogen mustards, tyrosine kinase inhibitors. Actually, options from A to D, they are all chemotherapeutic anti-cancerous drugs, while the calcineurin inhibitors, these are actually immunosuppressant drugs. So E is the correct option here. So all these classes of drugs can be used in chemotherapy of varieties of cancer except calcineurin inhibitors. Now the sixth MCQ, all of the following generics can be used in diarrhea control except. So we are asked to identify the drugs that are anti-diarrheal, but one which cannot be used for the management of diarrhea. So loperamide, methyl cellulose, aluminum hydroxide, bismuth subsalicylate, these are all anti-diarrheal agents, but one, bisacodyl. Bisacodyl is actually used in the treatment of constipation. So E is the correct answer here. Now the seventh MCQ, for diagnosis of HIV and AIDS in humans, primarily one of the following tests is carried out: gallium scan, ELISA test, pap smear, urodynamic testing, Western blot test. So we have to identify the test among these that is used primarily in the diagnosis of HIV and AIDS. So all these options are given, and the true option here is ELISA test. ELISA is short for enzyme linked immunosorbent assay. It is a biochemistry assay. Yes, and in this the immune system health is judged. So for diagnosis of HIV and AIDS in humans, primarily ELISA test is used. Now the 8th MCQ, bromocriptine is a dopamine antagonist, dopamine agonist, serotonin agonist, serotonin antagonist, histamine agonist. So actually bromocriptine acts by the mechanism of acting as an agonist on the dopamine receptor. Bromocriptine is a dopamine agonist drug, and this drug can be used to reduce the hyper secretion of milk in mammalians, maybe primarily humans, at least from our point of view. Yes, so this drug can be given to reduce the milk secretion in hyperlactating women. Dopamine agonist. So bromocriptine is a dopamine agonist drug. Now the 9th MCQ, the predominant hormone in the luteal phase of the menstrual cycle is, options are progesterone, estradiol, FSH, LH, GnRH. FSH is standing for follicle stimulating hormone, LH for luteinizing hormone, and gonadotropin releasing hormone, GnRH. So actually the predominant hormone in the luteal phase, that is the second half phase of the menstrual cycle, is progesterone. So A is the right answer here. Now the last MCQ of this video, which one of the following hormone is most directly responsible for ovulation in female cycles? Actually in this MCQ we are asked to identify the hormone that is most directly responsible in ovulation during menstrual cycle. So options are given: estrogen, follicle stimulating hormone, gonadotropin releasing hormone, luteinizing hormone, progesterone. Actually at the point of ovulation there is a surge in the hormone called luteinizing hormone, which leads to the ovulation in menstruating females. So actually D is the correct option here, that is luteinizing hormone. So luteinizing hormone is closely linked to the point of ovulation in menstruating females. So friends, this was all for now. I think this is enough, and thank you for watching. And if you have any question or some difficulty in understanding any of these MCQs or some